morning to you wherever you are, or good evening depending on where you are, and welcome to Parenting Tuesday this morning, where we are talking about shattering infertility, stigma. Imagine a couple in your neighborhood who has been married for probably a couple of years, and with time you notice that they're still waiting to have a child. The whispers around them, the harsh tones that, begin, and fingers start pointing at the woman mostly. But fertility is not just about her. It's not just about her struggles. Science tells us that in nearly 50% of infertility cases, men are equally affected. The World Health Organization estimates that 17.5% of adults globally live with infertility. So this means our men, fathers, husbands, and also our brothers are part of the story too. So this morning on Parenting Tuesday, we confront this stigma head-on, and we'll be talking openly about the fertility issues, including challenges and possible solutions. And I will be talking to an expert with me in studio, and also a lady who is actually bold enough to and who's going to open up her world to us as she walks through this journey from silence and shame to empathy and empowerment and much more. Remember, to be part of this conversation, you can join us on 20316, which is our WhatsApp SMS line, 0786-316-316. That is our WhatsApp line. And so be part of this conversation as you also help me welcome my amazing, beautiful ladies who've created time to be here with us. I really want to appreciate that. Welcome, Daktari and Susan. Susan, I'll start with you to introduce yourself, and then we come to Daktari.
Hello to our viewers. I'm Susan, and thank you, Sally, for having me. I'm also happy to have met you, Daktari. And yes, I look forward to a good conversation.
Amazing. Karibu sana, and thank you. Doc?
Hello to our viewers. My name is Dr. Egla Nyakoa. I just completed my ML in obstetric and gynecology, and I work in an IVF clinic. Okay. I've worked there for 6 years.
Yes. Fantastic. Thank you also so much for coming and making time. Probably to start us off, what is infertility, and when should one be concerned? They're not having a child. At what point should someone now be concerned?
Okay. So we can define infertility as inability to conceive after trying. And when I say trying, I mean regular unprotected sexual intercourse for 1 year if the woman is less than 35 years, and 6 months if the woman is more than 35 years. Okay. So when to be concerned is if you have tried for 1 year and the woman is less than 35 years, or for 6 months. The duration is shorter when the woman is more than 35 years of age. And also if maybe you've already done some tests and they have already indicated that you have some issues, then you don't have to wait for the 6 months or for the 1 year to seek for help. Yes.
Susan, this is your journey. This is basically your story.
Yes.
Probably just to start us off, at what point in your life did you discover that probably you have this challenge of getting conceiving, and what age was that? Were you in?
I was in my mid-20s, because I was 20, 24, 25 there. And I had been married for a year. And the first year it was, we were intentional, we don't want to get pregnant. Though we never used any family planning, we were just trying the natural way of avoiding it. And so the second year is when we decided we want to try and get a baby. It was not even trying. We knew we want to get a baby. And we were very hopeful. Of course, we had already had it in our mind, how many children we'd want, at what point in life we want, and all that. So everything was well planned. And so in our second year, we tried, and kind of for me, even when I was getting into marriage, I had already seen people who had struggled with infertility. So it was back in my mind. So I was very keen to observe what is happening. So in like 2-3 months when I was not able to conceive, I went to look for help. So I went and I saw a gyna, but the gyna told me, I think it's early for you to start fearing. But again, he said, since you have also been active for a whole year, and actually he realized even the way we were calculating our days in the calendar was wrong. So if we were to conceive, we would have conceived. So he told me, I will not tell you to wait for a whole year. if you go like for 6 months, come back. We need to see what is the problem. But as for now, just relax. And so I went and I waited for 6 months. Nothing happened. And that's when now I started getting curious. What is happening? Yes.
Okay. Daktari, she talks about trying at the age of about 24. That's a prime, to call it, is it?
Yes.
So what would be some of the causes, because she's pretty young at that time, she's active sexually. So what would be the cause?
Okay, maybe she, I don't know how her cycles were.
Right.
So if her cycles were irregular, maybe she could have been having ovulatory issues with polycystic ovarian syndrome.
Okay.
Or regardless of age, someone could still have a blocked fallopian tube.
Right.
Yes. And also now for the man, because we have just said that infertility involves both the male and the female.
Absolutely.
So if the man, maybe there could be issues with the sperm. Yes.
The sperm count.
Yes.
Okay. Sperm count, sperm quality. I think
sperm
we'll
count.
come into that.
Yes. Sperm count, sperm quality.
Okay.
Count the number, quality, the morphology, how the sperm is appearing, and how it's moving, the motility.
Oh, the motility.
Yes.
Okay. How are your menses? Like, how was your cycle like?
Very normal, till to date, and I thank God for that. No pains, no nothing, and no skipping, no anything.
Wow.
Very normal and very smooth. And so it was kind of hard for me to even think that I have issues in infertility because of the little biology that we had. We knew you must be having some complications maybe in your menses and all that. But for me it was normal. And I would say everything me in womanhood, quotes in quotes, was okay. So when I went and the first test I did was HSG, a very painful test. Yes, I went through it, and they said one of my tubes is blocked, one of it, and but even they said halfway blocked.
Right.
So they said maybe I could try again, as they would say that the dye can help to open, but it's not a test I would have been so comfortable to go for again. But generally my issue was now the blocked fallopian tubes, of which now later on I came to realize I had had an operation, a surgery, before even getting married. And now I realized that wherever it was so close to my fallopian tube. So that was the cause of the blockage for the one that was blocked.
Okay. That was one fallopian tube block, Daktari. But I hear, you're the expert though, that you can conceive with one.
Yes.
What happens here? How is that possible? And why couldn't she conceive with that one that was opened?
Yes, so it's possible to conceive with the one fallopian tube that's open, because if ovulation is occurring on that side, then that fallopian tube is able to pick the egg, and fertilization will occur, and conception can occur.
Okay.
So for her case, sometimes even if we have both fallopian tubes open, sometimes we have infertility where everything is okay, and still the couple is unable to conceive.
Okay.
Yeah, so sometimes we don't even have the specific reason why she was not able to conceive with the other open, because we've had many cases where someone has one blocked fallopian tube, the other one is open, and they will still conceive because that is still functional.
Okay.
Yeah.
Just out of curiosity, Susan, you've gone through all these tests. You've done the HSG, I'm sure that, checking the egg reservoir and all those things, right?
Yes.
Was your partner doing or going through the same?
To start with, when I started going for the treat or seeking for advices, I wasn't going with him because at first he also felt it was too early for me to start getting worried. But as I said, for me, because I had seen people struggling with infertility, I wasn't taking chances. And also the guy I met told me, you are young, you have all the opportunities. So then I started rushing with time. I don't want to come to a point where they tell me you are no longer too young for this.
Exactly.
Yeah, so at first we were not walking the journey with him, but now at some point he was able also to come in when he realized it's kind of taking long, and year is gone, and now we're in the second year. And most of the time men will assume they are okay, because I remember when I was starting the whole journey, he was like, I was telling him, the gyna told me you should also go for test, and he was like, but me, I'm okay. The confidence, I know. And I'm like, do you have a child somewhere? I don't have, but I know I'm okay. Yes, so there was that. But finally now when things came now real, you know, there comes a time when now you have to face this.
Yeah.
Yes, he went for the test, and yes, sure to it, he was okay.
Okay.
Yes.
Dr. Just for someone who's listening probably and they're also having some challenges here and there, what is the importance of having clear and clear diagnosis, you know, instead of, you know, when I look at those traditional things, how important is that?
So it's important that we have the clear diagnosis so that we are able to know the next step of management.
Right.
Because, for example, if the problem is blocked fallopian tubes, then we know the next step, maybe IVF. But if we find that the fallopian tubes are open, the sperm is okay, then we can try ovulation induction and maybe intrauterine insemination or timed intercourse. So when you know the diagnosis, then you're able to intervene correctly depending on what the diagnosis is.
Okay.
Yes.
Fantastic. For you, Susan, this will, you're in a second marriage, right?
Yeah.
Did this issue affect your first marriage? Did it play any role?
Yes, it did. It did, because when you're fighting infertility, it comes with its share of things, because you're also not okay psychologically. Emotionally, you're not okay. You're looking at, the society has already started looking at you. People have started asking, and you know, I did a wedding, and after the wedding, people are really scanning when you're alive. And when you try to make a post, our first anniversary, second anniversary, you are raising curiosity. So yes, it affected to a big deal, because we were not normal people. So anything else would trigger. If you step on my toe, hey, are you stepping on me because I'm infertile? You know? So if I mean, like, you become oversensitive, you live a life like you're walking on an eggshell. So it really affected our marriage, I would say.
Okay. Okay, so sorry about that. Dr. There's secondary infertility and primary infertility. What is the difference between those two?
Okay. So primary infertility is where a couple is unable to conceive. They have never had a child. They've never had But secondary infertility is where they've had children previously, and then subsequently they are unable to conceive. So that's the difference.
It takes time. Huh? Okay. And now, in this case for Susan, for example, the stigma, what would you tell people out there? You know, because expectations, society, what we expect. In the moment she says, she posts something and only one, nakwani hamja, barikiwa or something. What did you tell people out there who are very quick to judge?
You see, infertility is not, for example, Susan did not decide that she does not want to get children. So it's a reproductive inability that, with a medical condition, I would say that. So the society should understand and empathize and offer support instead of stigmatizing, instead of pointing fingers and, you know, trying to say this person is inadequate because they have not been able to conceive, because it's a medical condition that their reproductive system has failed to do the job of reproduction. So they should really be supportive and really be empathetic, and instead of stigmatizing these people, because Susan has told us she was trying. She's gone to see a doctor quite young, and the diagnosis is not even clear because only one tube is blocked. The other tube could still function, and it's still she was unable to conceive at that time. So people should not be quick to judge, quick to stigmatize, quick to point, because it's not her own doing. That's what I would say.
And also the importance of, because, you know, even at that age she was quite knowledgeable about, you know. So what is the importance of just having that knowledge? It's very important, because it helps the person to seek for help early. Because like when she went to her gyna, the gyna said it's early. I would have said it's early as well. Exactly.
And I will do the investigations, and if everything is fine, still give them a chance to try. So it's important that you seek help early. So if people have the information, it helps their health-seeking behavior, and also it helps with understanding that this is not a curse. This is not, you know. Yeah.
Because there's so many things, you know, that people say. I don't know, Susan, if you've experienced that. First, have you experienced stigma? And also things like what Dr. is saying, oh, your caste, oh, your lineage, this and that. Did you experience that?
Yes, and one of the major things, I come from a very committed Christian family who do not practice many of traditional things and all that, including when I was getting married. So that one came out very clearly. Maybe it's this and this was never done. Your dad said he cannot practice this, so maybe we need to revisit. And I'm wondering, so where will we go? Because the same home we were, it's the same home we'll go, and he will say no. So we tried, there was that, that you need to go and try, make things right, because this and this was not done during your dowry. And I wouldn't think that is correct. I never tried them. However, I've seen people who have tried them, but still they are not having children. So definitely that was not how. You asked whether I faced stigma. I would say I faced a lot of ridicule. And as you asked whether it affected our marriages, it was part of the things that were really being used against me. And also, like I remember there was a lady like we had a difference, and she had to remind me and tell me, I think no wonder you don't get children. And I'm like, okay, what does this has to do with me getting children? So it comes out a lot, and people think that's now the thing they can use now to pull you down.
Exactly. And that's only if you allow them to pull you down, isn't it? Has this in any way affected your identity, or had it, because right now I know, had it affected your identity as a woman at some point?
Yes, it did, and thank you for correcting yourself, because today
I know you.
There was a time I was really not myself, and I didn't, actually I was put in a confusion, and especially when my marriage failed, I didn't know who I am in the society. You know, sometimes you just want to call yourself a single mom, and that is it. And especially in church, I didn't know whether I'm in the group of youths, I'm in the group of who am I exactly? So I was a bit confused, and I didn't know who I am, whether to identify myself with the ladies who are not married, whether to identify myself with the single moms, whether to identify myself with married women. So I was kind of lost, and it was painful for me, because I was living a life where I don't know who exactly to associate with. Yes.
Okay. Dr. The issue of there's so many other reasons why you know someone cannot conceive, and we didn't delve quite deep into it. But speaking of the blocked tubes, is there a surgery or something, a solution to that?
Okay, so with blocked fallopian tubes, it also depends with the level of blockage. So along the fallopian tube. So if it's blocked, maybe towards the end, it can be, they can try to unblock it. But if it's blocked quite close to the uterus, where the tube is attaching to the uterus, then the surgery might not help. And even when you try to unblock the fallopian tube, it just gives like a 4% chance of natural conception.
All right.
Yeah.
What other reasons are there in terms of causing infertility?
So for infertility, we have the male and the female factors. So for the female factors, we've already mentioned about the blocked fallopian tubes. I just mentioned about ovulatory issues, for example, in polycystic ovarian syndrome. And then we can have structural issues, for example, uterine fibroids, if they're really touching the middle of the cavity of the uterus. Things like endometriosis, they can also affect ovulation sometimes. And also age. Age is a very important factor, because with age, then there's the ovarian reserve depletion, then the quality of eggs is also going down. Then for the men, we have semen issues. So we have the sperm. We can have the low sperm count, where the sperm is low, or we can have zero sperm count, where there's issues with production of sperm. Or we can have, also men can have blocked vas deferens. Vas deferens is the conduit that brings the sperm now to the ejaculate. So they can have blockage there as well, and that can also cause infertility. And also now for the both male and female, we can have where we have infertility without a reason, without knowing what exactly is causing the infertility. Where everything is fine, the sperm is fine, the ovarian factors are fine, the tubes are fine, but still this couple is unable to conceive.
Let's talk about substance abuse, for example, or even smoking. Does it contribute in any way?
Yes, so lifestyle is very important. Substance abuse, alcohol, marijuana, obesity, those things will also affect.
Okay.
Yeah.
Susan is a married lady right now, as you know. For those who don't know, she's married. Actually, you didn't say that bit.
I should have.
Wait for Mr. Mushiri at home. Anyway, but you're married, Susan. You know, by God's grace, you are. Before you got into this second marriage, did you have this discussion with your now husband?
Yes. First of all, informing him was not a big deal because he had already seen my story. He saw me when I was sharing my infertility journey. So he knew that I've gone through the infertility journey. However, I would still advise anybody, even if your husband has no clue of who you are, because I've also met with women, I'm working with many women, and there are people who tells me, let him know when I'm there, we will deal with it there. But I think just the same way you would inform someone where you work, what you do, not because it's supposed to affect your relationship, but because it's supposed to inform the way you're going to relate. And also you allow them to make a choice. Because you may be hopeful that you will get, but that's not the direction God wants for you, that you will ever be a mom. And maybe this person wants to be a dad. So instead of getting into it and now starting having conflicts, just the same way we advise a single mom, don't hide the fact that you have a child at home. So even in this one, I would advise someone, just have the conversation. So for me, it wasn't hard because already he knew.
Yeah, by the time he was bringing himself to you, he knew what to expect. But there's something you had mentioned before we started the show in terms of different ways of healing. Would you expound on that?
Yes. Maybe I would even ask myself, why do I share this? Why do I tell? Why do I go public and share my story? It's because I share the glory of God in his way of healing us. We will allow doctors to tell us the causes of infertility, the treatment and all that, because that's what God has graced them for. But on the other hand, like for instance, she has already mentioned that there's treatment for blocked fallopian tubes, which is true. There are women who have been treated and they have healed. See me here, it's what they diagnosed, it's what I've been treated for, and I've not been able to conceive. But there is a way that God has decided to heal me. Because healing for me, I would say healing is so diverse, physically, psychologically, and even your body. I thank God today I don't have any other body, health complications, because infertility is not the only health condition that is existing out there. And some people who are taking people through stigma, they also have their own conditions, but they want to make this one look like a taboo or something. So for me, I would say that it's true, infertility is painful, it's true, but God, when God comes, he heals us in his own way. So I am here because I have been able to face life, to accept it, and to be healed by God. So there is that bit of healing.
Wow.
You could be having children, but you are not healed in your heart. Yes.
I love you bringing in the aspect of God. Yes, there is science, but there's also God. And I love that. And thank you so much for the feedback we are receiving this morning on this conversation. And asked by someone here called Mosala. Mo says, do we have secondary? Hi, Sally. I love this conversation. Thank you very much. Do we have secondary infertility? I think Dr. Ari responded to that already. Kindly ask Susan the natural way of doing it because I haven't understood. Okay, that will be responded to. Susan, would you like to respond to that?
Yeah.
Okay, shoot.
I want to think that the person asking that question is asking the natural way of family planning.
Yes.
And what I meant is where you just keep your calendar, you keep calculating your days and watching your days. Yeah, that's actually the natural way.
Okay, fantastic. And it works, eh? Okay, does it work, Dr.
Maybe
Dr. Ari, does it work?
So if you have a regular cycle, very regular cycle, it could work, the safe days, although it's not, definitely the failure rate is quite high, yes, but if your cycle is quite regular, then it could work.
All right, when you say safe days, if it's a regular cycle, probably give an example, 30 days and whatever. What are the safe days there?
So the first 10 days of your cycle, the egg is still growing, so it has not ovulated.
Yes.
So that's also safe.
Okay.
And then between that, the 10th day to around the 15th day, that's the period where you could be ovulating.
Okay.
And you have to understand that sperm lasts in the system for like 72 hours.
Yes.
And an egg is fertilizable within 24 hours. So you could have maybe 3 days to your ovulation. If you have intercourse, you could get pregnant.
Okay.
Because now the sperm will be waiting. Yes. Yes. And also towards the end of your cycle.
Okay.
It's also, the ovulation has already occurred.
Yes.
It's also safe.
All right.
Yes.
Okay. Good morning, ladies. My question is to Daktari. What should women know about maintaining fertility health even before they are ready for children? At what age do experts say the egg reservoir of a woman is depleted? So 2 questions for you, Daktari. Yeah, maintaining the fertility health and the age for depletion.
Yes, we have just mentioned before the question came in about lifestyle, substance abuse. Substance abuse, especially smoking for women, really affects women's fertility compared to men.
Okay.
Yes, excessive alcohol intake will still affect your fertility.
Okay.
And also another thing is preventing getting sexually transmitted diseases.
Yeah.
Maybe maintaining monogamous relationships. And also if you find out you have a sexually transmitted infection, then it's very important that you get treated early, because now sometimes you go untreated and then the infection goes into your fallopian tubes, goes into your uterus, and then will affect your fertility.
Okay.
Yeah, so prevention is better than cure. So preventing getting sexually transmitted diseases, and if you do, you get treated. Also, something else is about the BMI.
Okay.
So maintaining a healthy weight. Obesity will affect your fertility, and also being underweight will also affect your fertility. Yes, so things like exercise, proper diet, those are things that will also help with maintaining your fertility. Okay. The other question is about the age at which ovarian reserve is depleted. This is variable, but by the age of 45, then even if there's any ovarian reserve, the quality of those eggs is really not good to give us a live conception. Although some few people are lucky, they have conceived at 47, even 50. Yeah, so it's really variable, because some people have early menopause, some people have late menopause. But according to studies, age of 45, beyond 45, then the ovarian reserve is quite depleted.
Okay. Yes. Talking about, there's an issue when it comes to fertility health, abortion. You know, there are ways or unsafe abortions out there, and we've seen young people really going through very crude ways of getting rid of that child. How does that affect fertility in future? Does it?
Yes. So if unsafe abortion will predispose this person to getting infection, infection can climb up, block your tubes, affect your uterus. Okay. You can have adhesion, you can have scar tissue inside the uterus, and that you might not be able to conceive. Yeah, so that's how abortion will affect.
Okay, that's how it affects it. All right. Then there's a question for the brave lady sharing her encouraging story. I'd like to know if she has considered egg donation, surrogacy, or adoption, probably even IVF. If not, why?
Okay. Yes, egg donation, no, because for me, I didn't have an issue with my eggs. So the tests were able to show that I actually had very healthy ones. Yeah. And my uterus was okay, and so I really, they were able to diagnose the specific issue condition that I was having. So I didn't try that. However, I tried IVF. I went through IVF, and remember the doctor was telling me, your chances are very high. One, you are young. Secondly, your eggs are good. Then your uterus is in perfect condition. And he was even making jokes and saying, I'll give you 3 triplets and all that. So I've not tried egg donation, but I have tried IVF, yes.
Okay.
Yes.
Surrogacy?
Surrogacy, no, because of what I've explained. I have no issues with my uterus. Exactly. I have no issues with my eggs. Yes. Okay. So for surrogacy, you go, well, maybe the doctor is here would tell us why would someone go for surrogacy.
Yeah, sure. Yeah.
For your case, you did not need surrogacy because your uterus was okay. But sometimes when we do IVF, maybe more than 3 times, where now we say we have recurrent implantation failure. Yeah. So even if the uterus is fine, then this person can consider surrogacy, because now implantation has failed to occur several times. Then that we can surrogate can be indicated.
But there's also you want to say something, Susan?
No.
Oh, there's also is it a myth that surrounds surrogacy in our African traditional society? I don't know what have you heard about surrogacy in our African setup?
I think what I've had more of that has brought some questions here and there, but I thank God now we are coming out of it. Is IVF, when they were calling them test tube babies.
Yes.
And you see now for surrogacy, if you're not doing it the natural way where you give your husband or I don't know whether surrogacy is done by women, or let me just use what I know. You give your husband to another woman for them to conceive naturally. So if you're going the other way, surrogacy, it means you'll go through the labs. And you see now that idea of test tube babies. That's what has been for a long time.
Yeah.
And up to date, and I think that's the reason we need to have these conversations so much. Many of the families, because these children are there, by the way, IVF is very successful in our country, but many of the families will not talk about it when they get a child through IVF.
Yeah.
Reason being, test tube baby. And then we'll be looking at this baby and we are wondering, we are waiting to see how far the lab can take this child. Yes.
They're just normal children.
Imagine.
They're just normal children.
There's also the fear in our country, the law, again, which you have to, again, adopt your own child who you know biologically they are yours.
Yes.
So, and also, I also had the fear. I was asking one doctor, what if I go for surrogacy and the lady decides to go away with my child?
It happens, really. It does happen.
Yes.
It does.
So I think the gap is lack of awareness. It really need
knowledge
to
gap.
be,
Huh?
Yes.
Okay. Dr. We've talked about men. When we started, we've talked about, they also go through this and all that.
Yeah.
But why are men left out of this conversation a lot? Do they come to see you in your clinic, for example?
Yes, we have men that are coming out and coming with their spouses for treatment. And as you started and said that it's actually 50%, both like 50 for women, 50 for men, the issue of infertility. So I think maybe just society, like how we have been brought up, our cultural practices, and the fact that the woman is the one carrying the pregnancy. So because she's not the one carrying the pregnancy, then the woman is a problem. Maybe that's how. But ideally, infertility is a couple's journey.
Yes.
Infertility is a couple's journey because we need the egg, we need the sperm for fertilization to occur, for conception to occur.
Yes.
But we've had men are actually coming up.
Right.
Men, I will comment the ones who are coming
Fantastic.
up, coming with their spouses,
Yes.
coming for checkup, coming for investigation to be evaluated, and we are finding it could either be the man or the woman. Yes.
Because of that moral support.
Moral
as well.
support.
Very important.
And sometimes it's the man who has the issue, and the woman has to be there. Or the woman maybe has to accept to undergo IVF.
Yes.
Because maybe the man has very low sperm count, and IVF with the fertilization in the lab is what can only help them. And some couples are able to conceive.
Okay.
Yeah. So in that case, it's the woman who is okay, and the man is the one having issues.
Okay.
Yeah. So I think it's really, really a couple's journey that it's important that the couples work together in this.
Okay.
Yeah.
Let's talk about costs, Susan. Then Dr. we also ask about the cost. How was it like for you, going through all this treatment, the tests and everything? What was the cost? What are the cost implications?
Quite high. Cost in our country is high. I've never lived in another country, so I don't know about other countries. So I talk about my country. It is high because first of all, even to see a gyna, it's a cost by itself.
Yes.
But I thank God because nowadays, even in the government hospitals, now you are able to access those services. So getting to see a gyna, then the infertility treatment is also not very cheap. Even before you go even for the IVF. And also now again, there is the cost of moving from one gyna to the other. You are thinking this one is not helping me. I need to go and see this one. I need to go and see this one. Again, there is what people will prescribe for you. You can take this, you can take this. So you go and buy those humble things and they are quite expensive also. You try them. So you really need to be well financially if you are looking for a child. Yes. Not even mentioning about IVF.
Yeah.
Oh, IVF is costly.
Yes, it is. Dr. do you agree to that?
Yes, I actually agree.
Yes.
Unfortunately, IVF is very costly. And I think because it's private.
Yeah.
So then no I'm not defending anyone. Maybe because the medication, like the injections that you have to get, those hormones, they're quite costly.
Yeah.
And even the lab, the things that are required, even setting up just an IVF lab is quite costly.
Okay.
Then the things that are required, the media, the things that the incubators, just maintaining the IVF lab also is very expensive. And now this cost all goes to the client, goes to the patient. Yeah, that's the unfortunate bit. But I think if IVF was available in a government hospital, then maybe there'll be a bit of reduction in cost.
Okay.
Yeah. So let's trust God and hope that this is coming soon.
Yeah, because it looks like it's not 100%, but chances are quite high with the IVF. Yeah. And even the advantage of you can choose the how you call it. Yes, you can do that with IVF. Yes. Oh, fantastic! But that also is an
additional cost. Yes. Wow. Yeah. Now that's an additional cost. Wow. It makes it quite expensive.
That's what we call assisted reproductive technology.
Yeah.
Well, technology there. Go. Kind of support you've received from your spouse, in this journey, or even support groups. Would you say it is important to have support or people just around you giving you support?
Yes,
Susan?
it is very, very important. And maybe just going back a little about the cost. You see, if we're able to overcome the stigma, if we're able to normalize this thing, we would be helping many families. Tell me why we are able to do a harabe for someone to go for any other kind of operation, let me not mention any, but we have not had anybody doing a harambe to help someone to raise 1 million, because it goes to a tune of 1 million for you to do an IVF. So why were we not doing that? It's because, and even one doctor told me, do you think a man would come out to tell his fellow men, I want you to raise money for me? They'll tell you, let us help you to do these things so that you don't do this. So if we were able to normalize this, we could even help couples financially, because families can come together and say, let's help our and even if you go and fail, just the same way, if we raised money for you and you still died, we don't feel like we did anything wrong. So if we are able to really support these people financially, and also, most importantly, psychologically, because most of the time, you even reduce your chances of even conceiving because of the stress and the distress involved. You see, IVF, especially when you're going through it, is such a vigorous procedure, and it takes a lot from you. It takes your emotions, it takes your money, so you really need people to work with you. You really need that support. You really need to know that you can do it, and even if it fails, if you have people working with you, it makes the journey easier. For me, I would say, even probably the reason I was able to heal very fast out of it, because of my family where I am born. They were all there for me the moment I was able to share, because again, at some point, it took me years before coming out and now accepting and saying, hey, by the way, I have a problem here. And when I did that, the kind of love they gave me, the support, the assurance, and letting me know that I'm still a woman, I still have a life ahead, it really played a part of me healing. So I would really say, yes, it is very important. And most importantly, from your spouse. Yes. Because that's the only person you feel safe with, if they are able to support you. And I thank God, because today I am married, and my man is just such a supportive man, and the support system, that if I want to do it, to try IVF and any treatment, he will not stop me. He will tell me to go for it. However, he's not even pushing me to add that. So now I operate from a point of peace.
Wow.
Yes.
Peace, very important, isn't it? Dr. There's so many other traditional remedies. We've seen a lot of advertisements and all those, and testimonials, and actually some say they work. I don't know what your take is on traditional remedies when it comes to infertility.
Okay. So you see, traditional remedies, the issue with them is they delay seeking expert services. So someone has been taking some herbal whatever it is for 10 years, and maybe her issue was blocked fallopian tubes. So there's no way these traditional remedies are going to unblock those tubes for you to conceive. So it's one concussion for anything. This person is not giving birth, let's give them this. So you see, my take is, I think they will delay your getting the correct treatment that you need.
Yeah.
And also, what are we treating specifically? Because when you go to the hospital, you're able to get tested. We know, okay, your issue is ovulatory. You have a fibroid. Maybe you need surgery, the fibroid to be removed. Maybe your fallopian tubes are blocked. Maybe there's low sperm count. So where the traditional remedies, I don't know what exactly they're treating. And another issue is we don't know what is in them. Because it's important to take something that you know is safe. Like this medication contains this amount of this substance, this amount of this amount of this. So what is the component? What is the composition of this traditional remedies? So from my standpoint, I think it's just important people go to the hospital, get evaluated, because what exactly, and some of these traditional remedies could be harmful because the composition is not known. And then the dosages, how much are you taking of this traditional remedy? Yeah, I mean,
so for the ones that they worked, it was just actually, it was God's grace.
It was God's grace. They should just say. Yeah, I think.
Okay. Talking to Susan, we hear at least her relationship, her marriage is working. But do you think infertility actually puts pressure on relationships and marriages?
Yes, it does. It does. Because if you don't get the adequate support, infertility is emotionally draining. It's someone who will feel inadequate. Why am I not able to conceive? And Susan has really put it out very clearly that you need a lot of support. So if your spouse, for example, you go for checkup, and then maybe one of the spouses is fine, and then you're the one with the issue. If you don't get support from the other partner, then it will really affect. We've seen a lot of cases where a woman came with the first husband, did not conceive for treatment, even for IVF treatment, and then that person left her. Then she got someone else. Then she's come again for treatment. So it really takes a toll on relationships.
Okay. As we come towards the end of the show, first, very quickly, maybe you tell us, when you used to attend like baby showers or see a woman pregnant, did that used to affect you in any way?
By God's grace, I've never had an issue with that. I think I've always been these people who say I will celebrate others until it's my time. I've always been very open to it because first of all, I was in denial. I knew my time will come, so I had no problem assisting. And then by the time now I'm coming now to accept it, I've walked a journey where I absolutely have no problem. I planned for that. However, there were times I would see a pregnant woman, and even now when it comes to that baby shine, I'm looking at them and I'm wondering, only if I could be that way. I don't even want to deliver. I just get myself pregnant and I feel pregnant. So there were times I really used to really admire just having a pregnancy. There were times I was telling God, let me just carry a pregnancy even if I abort, even if it don't get me. Whatever it is. I admired that, but I didn't have a problem with celebrating others people. In fact, I've eaten a lot of jahe.
On behalf of the Musheri,
yes.
Okay. Your part in short as we come to towards the end of the show, to someone going through the same journey, what would you tell them?
What I would say is that infertility is a health condition just like any other, and we can heal out of it. We can learn to live with it. Just the same way, if I was born blind, I would still live with that, and I would still make the best out of my life. So to the families that are going through infertility, you can still make the best out of your life, even without children.
Fantastic. We'll end it there. Make the best out of life, even without children. Dr. in 10 seconds.
Okay. So as we had mentioned, that infertility is a medical condition. So it's important that we replace stigma with knowledge, so that we are able to understand, we are able to empathize, we are able to give hope and the correct support that people who are going through this journey need for their life to be fulfilled, because it's not their doing. that they're in this condition.
Okay.
Yeah.
Fantastic. Right there. Replace stigma with knowledge, you know. Do not just imagine that there's a serious problem or this one is, you know, the black sheep of the society just because they don't have children. And I want to thank you so much for your time, for your feedback. Thank you so much for making us be part of your morning today. Well, and also for our partners, not forgetting you guys. Thank you so much for holding our hands and ensuring we bring you such informative, you know, and quite impactful conversation. I want to say asante sana. If you want to be part of this community that is impacting lives, you can do that by sending the word partner to 20316, SMS line or 0786 316 316. Send the word partner and our team will be out there to guide you through. And also, if you want to support us in any way, please do that on our pay bill number 316 316. Account number shall be your telephone number. We also have our cooperative bank account number, and it is right now on your screen. Cooperative bank account number 0113 6000 799100. Account name is TBN Family Media. God bless you and keep you. See you again tomorrow on Matters Finances, where we'll be talking about the high cost of living. God bless you and keep you. Bye for now.